So, sir, how was your experience when you came here? Like from landing from at the airport? I know it's a little chaotic in India compared to US, and we understand our limitations, but overall experience, now you have to finish the surgery.
Yes, my experience has been absolutely excellent. I was very nervous traveling to India. I had never been to India before. This is actually the furthest I have ever traveled. I don't know anybody here, and I was very nervous, but throughout this whole process, Dr. Kumar and I have been chatting on WhatsApp, and he's answered all of my questions right away. He responds very promptly, and I was very nervous about, just transferring flights and getting from the airport to the clinic. Dr. Kumar was even kind enough, I didn't know how to get an Uber or a taxi, and Dr. Kumar himself picked me up at the airport and was kind enough to bring me to his clinic. He's given me rides to and from my hotel. He's been very hospitable. His team here is excellent. They have been very kind to me. His wife, Dr. Mahila Singh, very, very wonderful woman. They're so friendly, took very good care of me. During the hair transplant procedure, we took breaks in between and had some really good meals that Dr. Kumar bought for me. Very delicious food. We went back in, finished the procedure, gave me instructions on how to care for myself. Everything went very smooth. My first time, night arriving here, I was a little nervous. It's very different from New York and the United States, so I was a little bit scared, but he made me so comfortable, and it's only my third day here, and I already feel comfortable and have no worries at all.
Now let's talk about one big point, cost.
Yes. Cost, oh yes.
So how should a hair transplant cost? How much should it cost? It depends on the location.
Yes.
You can say the brand value of a doctor.
Yes.
I think. Brand value of a clinic.
Yes.
Number of surgeries he's doing in a day. Even if it's a big brand, there's a different cost if he's doing 5 surgeries in a day, and it's a different cost if he's doing 1 surgery in a day. So what is your opinion regarding how the pricing should be? I
think, the pricing should be it should be reasonable, and it shouldn't be so overinflated. In the United States, it's like, $10,000 to $20,000 for a hair transplant, and all of the other, based on all the other research I've done, here in India, most clinics charge more than double what I paid here, and they're having multiple patients done in one day, and like we previously mentioned, the doctor is not even present in the room. Same thing in Turkey. The hair transplant that I paid for in Turkey was more than double of what I paid here, and my results were terrible, and the doctor did almost none of the work. So I am so glad that I found out about this clinic and did my research, because I paid a fraction of what I would have paid anywhere else in India, Turkey, and especially the United States for this type of care and treatment.
Nice. Yeah, to know. So we try to be reasonable. We don't try to charge more for a patient who's coming outside. He's already paying for the flight. Yeah. He's already paying for the hotels.
Yes.
He's already giving you a great review.
Yes.
So if we are doing a great work, we are also benefiting from that.
Yes.
So I feel he should be charged in the same way as a conventional Indian patient.
Yes.
We should be treating him in the same way as we would have treated any other patient.
Yes.
So let's be fair to everyone.
Yes.
Let's not be selective that he can pay more, shouldn't be paying more.
Right. A lot of and I know a lot of people, a lot of clinics in Turkey will, they'll include the cost of a really nice hotel in the package with the hair transplant. And
I think if he wants a holiday, he can book a resort.
Yeah, exactly. Yes, they make it very enticing by including, a nice, my brother and I went in Istanbul, we stayed in a nice Hilton hotel, and, it made everything seem very nice. And
that adds to the cost.
Yes. And we still paid more than double what I paid here, and we both had bad results. So
the core should be the surgery, safety.
Yes.
Experience, doctor's involvement.
Yes.
I think if these are missing, no amount of icing on the cake like hotel, hospitality, tourist destinations matters in hair transplant industry.
Not at all.
Not at all. So it's a result and the great follow-up. The follow-up of the patient with the doctor should be excellent. He should be explain what are the things which should be done after the surgery.
Yes.
There should be hand-holding till he starts getting results.
Yes.
So the results starts coming after 3rd month, and it keeps coming till 7 to 8 months. If the patient has some other issue, we should be able to tackle those things. So do you have any idea about which technique should one adopt while getting a hair transplant? People also research about a lot of techniques. Doctors brand their clinics in name of techniques. Technique X is better, Y is better, Z is better. I think it's a doctor's experience. If he is able to deliver good results with the technique he has practiced the most,
yes,
he is fine.
Yes. So I believe for me, the FUE, the follicular unit extraction, or DHI,
DHT.
yes. I think those are the best and more modern techniques.
Yeah. So use of implanters prevents damage to their grafts while implantation. FUE is a basic technique, so it fast tracks the healing. You don't need a stitch. Or a strip surgery, so he's fine after 2 days of surgery, and the healing time is really quick. So rest is all about doctors and team's expertise. It's not about like if you adopt technique X, you'll get better result. You adopt technique Y. So even if the technique X is the best and the doctor is not involved and he is doing multiple surgeries, it can still be sabotaged.
Yes.
This is what I feel.
Yes, I've seen a lot of clinics in Turkey and India advertising, DHI, it's even more, simplistic than FUE and blah, blah, and they make it sound so easy and great. Mm-hmm. And then you see some of the results of those patients and they're not good at all because the doctor is not involved, and I don't know what technique they're actually using, but they advertise it a certain way.
Yeah, and ultimately it's how you handle the grafts. So what you take out should be planted back properly.
Yes.
If that handling of graft is proper, the results will come.
Yes.
If there's no dehydration of the grafts after the surgery for next 7 days, the grafts get accepted into the skin, and until it develops a blood supply, you'll get the results. So it all depends on how you manage the surgery and how you manage the post-operative period.
Yes.
And then his diet has to be good, high protein diet, good supplements, minoxidil, finasteride if he can take it. And that is also needed to maintain the result as well as to get the result. You can say scalp, which is where there's miniaturization. So you have to remove all the negative factors in it. So nice to know that you had a great experience here.
Yes.
And your gut is fine, sir?
My gut, everything is fine. I feel fine. But Dr. Kumar called me on the phone and went over everything with me first, and he texted me directly. So we've been in touch this whole time. I knew it was him. I just had that gut feeling that it was really him. It was good, and everything was just smooth and no problems at all.
Great, sir.
Yes.
So it was nice meeting you.
Thank you so much for everything.
I wish you best wishes for the part 2 of your journey to India.
Yes, thank you.
We wish that you are successful in life.
Thank you.
And you have a great hair, not only great hair, great health.
Yes, thank you.
Yes. Thank you, sir.
Thank you for the great work and everything.